Hi everybody, my lecture name Pregnancy, Normal and Complicated, Development and Physiology of the Fetus. I'm Dr. Nuha. I work in the Maternal and Neonate Nursing Department, College of Nursing, University of Baghdad. In the beginning of the lecture, I produced this question to answer in the end of the lecture. Is a little knowledge is a dangerous thing? So, the objective of the lecture. The end of lecture and of the student able to define related terms, calculate expected date of delivery. This objective can be explained briefly because you can take in lab lecture. Describe fetal growth states, describe fetal development, cell divisions, الجيماتوجينيسيس, الأوفيوم, sperm, summarize the process of fertilization, describe implantation, describe the embryo and fetus, the composition and function of amniotic fluid, describe the umbilical cord, describe the development, structure and function of the placenta, summarize the growth and development of the embryo and fetus. This terminology in my lecture very important to understand this lecture. Anti it's mean before. Anti it's mean before. Antepartum. Partum is the time before delivery. Anti before. Antepartum it is the time before delivery. Gravida any pregnancy regardless of duration, including the present one. Prenatal time before birth. Prenatal time before birth. Nil gravida, a woman who has never been pregnant. Never been pregnant. Para, number of birth after 20 weeks gestation. Preterm, a pregnancy that ends after 20 weeks and before 37 weeks gestation. Postterm, a pregnancy that goes beyond 40 weeks gestation. The prima gravida, a woman pregnant for the first time. Pregnant for the first time. Multi-gravida, a woman who is her second or subsequent pregnancy. Yeah, more than one. Nullipara, a woman who has not given birth at more than 20 weeks gestation. The primipara, a woman who has given birth to a fetus, dead or alive, that had reached at last 20 weeks gestation. Multipara, a woman who has given birth 2 or more times to that had reached at least 20 weeks of the gestation. Stillbirth, a fetus born dead. A fetus born dead after 20 weeks gestation, EDD, it's abbreviation of estimate date of delivery. G, TPALM, and BG are abbreviation of G gravida, total number of pregnancy, including the current pregnancy. T, number term of term pregnancies. P, number of preterm deliveries. A, number of abortion. L, number of live birth. M, number of multiple birth. P, para, number of birth after 20 weeks of gestation. G, it is gravida. Now, rule to determine estimated date of delivery. When make assessment with her mother or clients to know what are the expected date of delivery. Expected date of delivery اليوم المتوقع للولادة. How to determine that? Must be now the last normal menstrual period. So I ask my patient, my mother or my client in the hospital or in the clinic, what are the last menstrual period? Is the period normal? Every month, every 28 or 30 monthly? Take this time, day, month, and year. Count back 3 months, add 7 days. After that, correct the year if needed. Development and physiology of the fetus. Fetal growth stage. The pregnancy, it is the 9 months. Every 3 months called the first trimester, second trimester, third trimester. In the first trimester is a time between 40 weeks of the gestation. Is an important time in the baby's life. It's a time of the fast growth and development, and also time when the baby is the most at risk from hazards such as smoking, alcohol, drug, infection, and X-ray. First trimester, 3 months. First 3 months. You saw this picture. 3 months, that means 12 weeks. In the second trimester, it is the time between 50 to 27 weeks of gestation. During this time, the baby's brain grows a lot. The baby is still too small to live outside of the baby. Month 4, 5, 6 months means second trimester. In the third trimester, the time between 28 weeks and the baby's birth. The closer to full term or 40-week gestation the baby is, the better to able to coping with the birth and life outside the baby. In this trimester, it means 7, 8, 9 months, the baby able to go to birth process for the life outside the uterus. If the baby is born before 37 weeks of the gestation. Before 37 week of the gestation يعني قبل 37 أسبوع من الحمل. It's considered to be preterm. Preterm, it's a terminology for born baby before 37 weeks of gestation, born early. But if the baby is born after 42 weeks of the gestation, it is said to be post-term. يعني الولادة تكون بعد 42 أسبوع من الحمل، نطلق عليه post-term. And there are a higher risk of illness and death in the babies born too early or too late. In the first trimester, in one day, the sperm and ovum units, and after or during first 10 days, the fertilized ovum attached